I'm Brianna Martinez. I'm the owner and aesthetic injector at Muse Aesthetics and Laser in Tampa, Florida. I'm here with Joha today. So she is 30 years old, no real major skin concerns. Just wanting to start a little anti-aging, a little preventative stuff going forward. And so here we really like to focus on the skin as a whole, keeping the skin nice and healthy and plump, and keeping that collagen in there, because that's the main thing. Whenever we hit that mid to late 20s, you start breaking down collagen much more actively than you were in your early 20s. Only goal is really just to build more collagen than we're breaking down every day. So my favorite way to do that is by using the CO2 laser. I personally like the Tetra Pro, that's what I have here, and we're gonna do the CoolPeel for her. The CoolPeel just means that it's a set of settings that we use that's going to give her a really beautiful result. It's gonna take off her little baby top layer of skin there, and it's gonna poke little holes in the skin. So what that's gonna do is make it so that all of that dead skin and debris and everything comes to the surface, and then it's just gonna flake off. So she's gonna have fresh new skin, down a couple layers as well, and it's staying in that epidermal layer, but still it's going to give her like a nice radiant finish. It's going to help and get rid of this little bit of sun damage that she's starting to notice, make her body heal her skin by producing a bunch of baby skin cells and more collagen and elastin, which again is always the goal. Scale of 1 to 10 as far as pain wise.
Not even 1.
Amazing. Okay, so we do offer Pronox. It's like a laughing gas, so it helps with some pain and anxiety if you need it. Generally with the CoolPeel though, people do totally fine. So we're gonna keep going on the second half of your face. So one of the other reasons, other than the results, that I really love the CoolPeel is that it is a CO2 laser, but it's pretty gentle as far as CO2 lasers go, and it has really mild downtime. It does have some downtime associated, but not as much as like a traditional CO2 that you might have seen online or something like that. So what she can expect today is really just to be red. That's really it. She's gonna feel probably like she has a bit of a sunburn, how you have that kind of warm feeling after having a sunburn. Starting tomorrow, she's gonna wake up still red. She might have a little swelling, especially around the eye area. That area likes to get a little puffy, or maybe not. Some people don't swell at all. And then she's gonna notice tomorrow little dots, like little sandpapery dots. What that is all that dead skin and everything pulling to the surface. Then what's gonna happen over about 5 days after that is that she's gonna start flaking. The redness is gonna subside, but the flaking really just happens while, like, when you're in the shower. You're not gonna be like flaking and peely during the day. It's really because of the steam. The steam starts to loosen up those dead skin cells, and then they come off. Usually by day 5 to 7, completely back to normal. But we like to call it more of like a social downtime for the first 2 days, because it's not like you're really in pain or anything like that. If you wanted to, at that 48-hour point, you could put some makeup on and live your life, and nobody would even know that you had anything done. And you'll just start to notice every day after you shower, your skin's gonna be smoother and smoother and smoother until you have that fresh baby top layer skin. That's that first like really good layer of results, is when you have that immediate gratification because all the dead skins come off, and so you have a baby top layer of skin. And then the next wave of results is gonna be about a month or 2 later, because that's another great thing about this treatment, is your skin continues to improve. It's not like, you know, a week later, this is what you got. If we were treating something specific, like say somebody had deeper smile lines or something like that they're really trying to get rid of now, what I would recommend is coming in once a month for at least 3 treatments to target that. So we would treat her whole face still, but to target that specific thing. She doesn't have anything like that. There's nothing specific that we're trying to treat here. So really what the recommendation is just gonna be general anti-aging treatments, roughly every like 6 to 12 months, depending on, you know, what her budget and her work schedule really allow.